Well, thank you for coming, everyone. Today by Professor Ben Cowie, the Acting Chief Health Officer. I've also been joined today by Dr. Neil Coventry, who is Victoria's Chief Psychiatrist, and Dr. Rick Haslam, who is the Director of Mental Health Services at the Royal Children's Hospital here in Melbourne. And if I can begin by running through some of the headline issues of the day and case numbers and a few matters before I hand over to Ben. So there were 176 cases reported yesterday of COVID-19, all locally acquired. 83 of those cases today are linked to known outbreaks, with 93 under investigation, taking us to a total of 1,029 cases in Victoria active at the moment, 1,026 of those being locally acquired and 3 through hotel quarantine. And currently in hospital, we have 61 people with COVID-19 in our healthcare, in our hospitals. 20 of those are in intensive care, of whom 13 are on a ventilator. In regards to vaccines and tests, yesterday there were 33,720 vaccines administered through the state clinics, and that brings us to 2.843 million in the state clinics over the course of that program, together with the other parts of particularly GPs and pharmacists. Now has passed 5 million doses of vaccines for COVID-19 applied in Victoria, which also brings us to more than halfway to our recent 1 million vaccines in 5 weeks target that we launched a few weeks ago. Because we know that vaccines continue to be the way out of this pandemic and the way to gradual easing of the restrictions, and there is no more important thing than either getting tested if you show any signs and getting a vaccine as soon as you can. So please book an appointment. And there were 48,372 COVID-19 tests processed yesterday as well. In regards to the breakdown geographically of the cases reported today, I can report as follows, that 61 of those cases were in the Western Metropolitan Melbourne areas, 67 were in the Northern Metropolitan Suburban areas, 22 to the Eastern and Southern Metro areas, 13 are linked to the Shepparton outbreak. There was 1 in Greater Geelong and 3 under investigation as to their precise origins.